Today is World Mental Health Day. If your child is struggling with anxiety, ADHD, depression, self-esteem issues, or even learning, there are places to go to get help and support. KIDTHINK Children's Mental Health Center is a place you can turn to for help. And joining us now to tell us more about KIDTHINK is outreach clinician Wendy Magnus. Good morning, Wendy.
Good morning.
Thank you so much for joining us.
Thanks for having me. This is great.
Well, this is great because it is a big thing that we need to talk about because parents need to know what are some of the signs that their kids might be in trouble. So before we get to that, let's just talk about KIDTHINK as an organization. What is it that you do there?
We are a family-centered approach, so we work with the children, we work with the parents, we work with the school teams, and we want to empower all of these people so that they have an understanding of coping skills and what they can do together to help the child feel more confident and support the caregivers along the way.
And you have quite a sort of a different group of members that work with you as well. Who works there and what are their skills? We're
all mental health clinicians. We are basically doing the same type of wraparound team approach. So there's some social workers, there's occupational therapists, there's psychologists, and we're assessment-based as well as treatment.
Okay, so if your child is struggling, or you think potentially your child is struggling, what would be signs that would tell you that there is maybe a problem?
Yeah, you need to be aware of, have they changed in terms of like sleep or mood or energy level? And then just, opening the door to that conversation and just saying something like, I'm noticing changes, I care, right?
Yeah.
And then slowly but surely, maybe reaching out to their school, the pediatrician, a mental health professional to seek help now versus waiting until there's a crisis.
Okay, and so often kids just want to be heard, right? They just want to talk.
Totally, yeah, and just be there, hold space with them, and just a very open, clear language, simple language. Even bringing in some scripts can be helpful because then children know what to expect.
And is that hard for some parents to have that open dialogue with their children?
No, I think it's there. It's just making it so that we go into that bubble of their quality time. So if your children are playing, meet them halfway and sit down and really try to, play, enjoy, and then sometimes it just starts opening up, right? And kids then start talking.
Okay, and so if your child is talking and is asking for some assistance, some help, what's the first thing you should do?
First thing you should do is listen, right? And sit with them and be supportive, but also normalize it and have them really see that you know what to do, that you can reach out and there's people out there that can help. So like I said, pediatrician, mental health professional, school team.
Okay, and often when the parent realizes their child is in need of help, they can collaborate with the school, they can talk to the school, so there are signs that over there that they're aware of, but also get some help from an organization like KIDTHINK. So what's the first thing that you would do? Would you call KIDTHINK?
Yep, call KIDTHINK. We have an info line, and then they'll organize it so that there's a clinician that's connected to the family, and then we meet and we do an initial assessment. We get to know all the information, and then we start seeing the family as a unit, as a whole.
Some families might be struggling with cost to get their kids the help they need. What does that mean for you at KIDTHINK?
So we assess everybody's, like financial situation, and there's a sliding scale. So it's different cost for everybody. And there's also an FFCC, meaning that we're fully funded for 10 sessions. So it really, we look at all of that, all those factors, and decide. Anything else you want parents to know? I just want them to know that bottom line, if your child is failing, it's not that you're parenting poorly. It's that we're all human, and the first step is reaching out and knowing that there's support out there and that there's people that can help.